Hello, all my dear fellow compatriots. Dear viewers and subscribers of our channel. Patients suffering from type 2 diabetes always have one question. Can type 2 diabetes be completely cured? In search of an answer to this question, they look through social networks, search the internet, read information, and when patients come to consult with doctors, they ask the doctors, is it possible to be completely cured? Is it possible to get rid of diabetes? Is it possible to stop taking insulin or to avoid using blood sugar lowering medications? Can it be treated so that our blood sugar doesn't rise anymore? These kinds of questions are heard quite often. When we examine patients with type 2 diabetes, we find that in 90% of cases, the pancreas's ability to produce insulin is not impaired. In fact, in some people, insulin is produced in excess. It's just that the insulin cannot fully exert its biological effect, a complete disruption of function and the biological effect of insulin. This is called insulin resistance, the state of insulin resistance. Causes of insulin resistance can include being overweight or obese, sarcopenia, low muscle mass, vitamin D deficiency, deficiency of male and female sex hormones, and dyslipidemia, meaning elevated blood triglyceride levels. If the underlying factors causing this significant insulin resistance are effectively treated and completely eliminated, the pancreas is actually producing a sufficient amount of insulin, and its vital secretion is not at all impaired. In that case, it is possible to get rid of diabetes. Now we present our conversation with the patient we just mentioned. Hello?
Hello, peace and blessings.
You first came to our esteemed clinic approximately 25 years ago, specifically in the month of September, if my memory serves me correctly. You came in September. At that time, your fasting blood sugar was 6 or 7, and after meals, it was 10. Your glycated hemoglobin was also 8.5. Yes, we examined you. When we examined you, we found that your pancreas was producing enough insulin. When the level is much higher than necessary, in most people, about 90%, there is a lot of insulin. The problem is that the insulin just isn't working. This is called insulin resistance. I found the cause of your insulin resistance. You had excess body fat, a slight deficiency in your overall muscle mass, your testosterone levels were notably low, and your vitamin D levels were also significantly low. It's been almost 3 full months since you initially started the comprehensive treatment plan.
Yes, it's 3 months.
3 months have passed. Now please tell us, what complaints did you have when you first came in? And do you still have those complaints now? How are you feeling now?
When I first came, I had those issues, so I went to a urologist. When I went to the urologist, they said everything was fine, but then they told me to get a hormone test. After that, they advised me to consult with you. I came and I did the tests. That day it came out to 6.8 or 6.9.
Is it really 6.9?
Yes, it came out to 6.9 like that. Then the next time it was around 10. It was 10. Then after 3 months it was 8.5.
8.5.
Then after that, if you treat it, it can go down to 7 as well. In this medical condition, it is indeed type 2 diabetes.
It's just like how the pancreas is used.
The thing is, when there's a lot of insulin...
There was a lot of insulin.
Yes, but the only thing is, laziness has become a habit, no effort.
The insulin isn't working effectively, it's not doing its job.
Yes, after that you prescribed a diet for me. And you told me to exercise regularly. Then there were 3 recommendations.
So, what are you not eating now? What foods are you avoiding, or what have you replaced, and what did you give up?
Yes, so after that I stopped eating dough-based foods regularly. For about a month and a half, I didn't eat any dough-based foods. At that time, you said if I eat pilaf, I could have 1 bowl, or at least half a bowl.
Right.
So I did that and came back. Then, when things settled down, I started walking 10 kilometers, sometimes 8 kilometers a day. But this...
So, are you still walking?
Walking.
How many times a day do you walk?
I walk once a day.
8 to 10 kilometers?
At a time.
How did your fasting go? How did your blood sugar level drop? What did it drop to at first? Look, you weren't given any medication to lower your blood sugar. You were only given what you were lacking. After how long did it drop to reduce insulin resistance? What did it drop to?
In about a month or a month and a half, it dropped. In a month after you started doing that, it started being recorded every day, for example, up to now. 3 times after meals, so 6 times a day. On an empty stomach, it was 4.9. After meals, it was 5.9. And on a full stomach, it was 9. If I remember correctly, when I first came, it was 6.5, 6, and the truck was loaded.
Are you still actively continuing with your sports endeavors?
Yes, I am continuing with sports.
Now, when you came to us on November 25th, your fasting blood sugar was 4.6, and after meals it was 5.3 and 23. Okay, at that time, did you have any complaints like frequent urination, weakness, fatigue, or any other complaints? Do you have them now?
No.
You feel really good now. So have there been any significant changes in your overall weight during this entire time period?
Yes, there have been changes in my weight.
Did you happen to gain some weight?
Yes, I gained weight.
How about your energy levels?
My energy is good. Now, if I don't go for a walk even for one day, I might feel sluggish, weakness. That's precisely how it is, and then I typically walk a considerable distance, often 8, 9, or even up to 10 kilometers, enjoying the journey. But every day it's the same, either 10 breaths or 8 breaths.
The address is 21B Alisher Navoy Street.